Denial and dysfunction have been the two words of the day, words that are used by the Washington Post in a searing account of the failures of the Trump administration to take COVID-19 seriously as the virus made its way from China into the U.S.
True, good point. And Sanjay, you were telling us the last hour that there's an important context we need to keep this in, and that is that the flu is more deadly.
Yeah, I mean, you know, this is one of the ironies, I think, that always comes up with this. Take a look at the numbers. I mean, this is the U.S. flu season, this season alone.
Let's take a moment for some important context here. One person has died from the coronavirus in the U.S. By comparison, in the average year, between 12 and 60,000 Americans die from the regular flu.
How concerned should ordinary Americans be about this?
A lot of people are concerned about the coronavirus because they're hearing a lot of news about it right now. But the reality is, comparing it to the flu, for example, it's not even close to being at that stage.
And while we're still learning about the coronavirus, I want to give you some important context. So far, we know of fewer than 24 deaths from coronavirus in the U.S. By comparison, between 12 and 60,000 Americans die of the flu in an average year.
And while there's a lot of fear over this coronavirus, you know, the flu is already widespread in the U.S. and it really is much more deadly, is it not? I mean, the CDC is estimating that so far this season there have been at least 19 million cases of the flu in the U.S., 180,000 hospitalizations, and 10,000 deaths.
How worried should Americans be? Should they panic?
Good morning, Mika. No, Americans do not need to panic. The Chinese are already panicking, as they should, because this virus is spreading all through the central parts of China, and it's a new virus. It has never been seen before, so its mechanism of spreading is not quite known yet. What I would suggest, however, is that Americans take this as a wake-up call for seasonal flu. We are not out of the flu season.
Both at the domestic and international scale. But for Americans, we are more, prone to obviously getting seasonal flu than novel coronavirus. So certainly do get your flu shot. And take
we don't need to be overly concerned yet in the United States about the novel coronavirus. Right. We do need to keep our eyes open for the seasonal flu. We're right in the middle of the flu season still.
People should be more concerned right now with the flu in this country.
Absolutely, but we're still watching it, this developing story. Jennifer Ashton, thank you so much. We appreciate it.
How worried should the average American be given these flu numbers when it comes to coronavirus?
Right. So the risk in this country is still deemed to be low. Okay, that is the risk. That's one of the reasons why the CDC does not recommend that we wear masks, for example. By the way, wearing masks in this country is not recommended. So everyone who's going out there buying masks from Amazon and other places, we need to save them for those who need them. So right now, that's not the case. The risk is low.
So the CDC now has estimated that there have been 12,000 deaths from the flu, just the flu. How worried should Americans be about coronavirus?
Coronavirus is not going to cause a major issue in the United States. If we have it here, we have healthcare institutions that can cordon people off. We can take care of them, give what we call support.